Hi, this is Dr. Ravi Mohanka. I'm the Director of Liver Transplant and Hepatobiliary Surgery at Sir H.N. Reliance Foundation Hospital. Our department is one of the most experienced departments for liver transplant in Western India. We've not only been leaders in liver transplant, both adult and pediatric liver transplants, but also we have done some of the most complex, technically complex liver transplants in this part of the country. So some of the unique things that we have done in disease donor or cadaveric transplants, we have done split liver transplants, we have got or transferred livers from different parts of the country, and we have association with different hospitals in Western India to cater to organs that are donated in those regions. We also have regular clinics running at all these centers, almost 15 to 16 centers, cities across Western India, to ensure that patients who don't have to travel to Mumbai and they can get their care locally. As far as living donor transplants are concerned, we have probably the largest experience with pediatric transplants. Now, some of the patients who need, some of the children who need a liver transplant, they have what is called as a portal vein atresia, which means their portal vein, one of the blood vessels going into the liver is very thin. Such cases are done in the hybrid operation theatre which our hospital has. This allows us to address any of the problems that needs to be fixed during the transplant. As far as adult transplants are concerned, we do a large gamut of complex transplants for patients with difficult surgeries, patients who have undergone transplants in the past, those who have blockage of the portal vein called as portal vein thrombosis. We have done swap transplants for families who do not have a compatible donor. We do a swap transplant, exchange donors between two families. We've done dual lobe transplants in patients who are large and whose liver is from the donor is small. So two donors donate to one patient. It's like doing two transplants on one patient. Then we have done simultaneous liver plus kidney transplant for patients who have both organ failures, and several such complex operations we do routinely in transplants. As far as liver, gallbladder and bile duct cancers are concerned, because of this vast experience in liver transplant, we are able to offer very complex liver resection surgeries to patients to treat their liver cancer or gallbladder or bile duct cancers. We are one of the few hospitals in Western India that has a dedicated liver and a dedicated transplant ICU. This allows us to take very good care of patients who have acute liver failure, sudden onset liver failure, severe liver failure in young patients. We have probably one of the largest success rates without transplant in patients with acute liver failure and with transplant too. So there are several things that we are doing to enhance this field in the future. One of them is we do laparoscopic and robotic donor surgery, which again very few centers in India currently offer. We are also working towards establishing a robust donation after circulatory, the DCD liver transplant program.